This device can be cold enough to cause serious injury. Please be sure to read and understand all instructions before use. Additional warnings may be found in the instructions for use. The intended use of the Iceman is for temporary reduction of swelling and pain after surgery or injury. This is a non-sterile prescription device for single patient use to provide localized external application of cold therapy. Do not use this device on people with Raynaud's phenomenon or other vasospastic conditions, Buerger's disease, cold allergy or hypersensitivity, cryoglobulinemia, paroxysmal, cold hemoglobinuria, or other cold agglutinin disorders, pheochromocytoma, sickle cell anemia, or history of cold injury. Warning: read and understand all warnings and instructions for use before using this device. Additional warnings appear in the instructions for use. Warning: do not use this device without a prescription from a physician, RX only. Your prescription must state how long and how often the device should be used and the length of breaks between uses. Do not use this device if a prescription has not been provided to you or if you do not understand the prescription. Warning: this device can be cold enough to cause serious injury, including tissue necrosis. You must be able to check your skin condition under the cold pad. Do not use if you cannot check your skin condition frequently, at least every hour. Check for increased pain, burning, numbness, tingling, increased redness, discoloration, itching, increased swelling, blisters, irritation, or other changes in your skin condition under the cold pad or around the treatment area. If you experience any of these conditions, immediately discontinue use of the device and contact your physician. Exercise special care in prescribing this device for the following patients: those with arthritic conditions, peripheral vascular disease, children under 12, those with decreased skin sensitivity, poor circulation or compromised local circulation, hypocoagulation disorders, diabetes, or neuropathies. Be sure to let your prescribing physician know if you have any of these conditions. This product can be cold enough to cause serious injury. Read and understand all warnings and instructions for use. Your physician will be able to let you know how long to apply your cold treatment, how long your breaks should be, and the length of your treatment time. If you have any questions about your treatment plan, be sure to ask your prescribing physician. You will have one of the 3 Iceman models: Iceman Classic, Iceman Clear Cube, or Iceman Clear 3 Plus. Each of the 3 models will provide the user with a continuous flow of cold therapy for the prescribed length of treatment time. The Iceman Clear provides the user with a constant temperature and flow rate. The Classic and the Clear 3 Plus have the ability to control the temperature by adjusting the flow rate. Step 1. Fill ice to the fill line. Step 2. Add cold water to the fill line. Step 3. Place the lid on the device. Make sure the lid slides into the grooves, then press the front of the lid down to close and secure. Step 4. To apply the pad, use a barrier between your skin and the pad. Apply the pad and use elastic straps to hold the pad in place. Step 5. Attach the pad to the cooler. Press in the silver buttons, then link the connections together. You will hear 2 clicks, one from each connector. Step 6. To turn the Iceman on, insert the cord into the connection on the back of the device, then plug the power supply into the wall outlet. If there is any leaking, discontinue use immediately. Shoulder application. Apply a barrier between your skin and the pad. Apply the pad to the affected area. Position the long Velcro strap around the torso, securing in the front and the back. Position additional straps under the affected arm and around the bicep. Knee application. Apply a barrier between your skin and the pad. Position the pad on the affected area. Secure with Velcro straps below and above the knee joint. Ankle application. Apply a barrier between your skin and the pad. Apply the pad to the affected area. Use the Velcro straps to secure the pad using a figure 8 motion, starting at the top of the foot, go diagonally across the top, under the foot, back over the top of the foot, and around the lower leg. Warning: when applying the cold pad, do not let any part of the cold pad touch your skin. Always use a barrier between your skin and the cold pad. Check for moisture on the barrier between your skin and the cold pad. If moisture is present on the barrier, immediately discontinue use of this device. Storage instructions. Unplug the power supply from the electrical outlet. To avoid danger of electrical shock, do not unplug the power supply with wet hands. 1. Disconnect pad from the hose. 2. Drain cooler and wipe dry. 3. Drain pad by holding it with the hose hanging downward. 4. Press in the buttons at the end of the hose and allow all water to drain out of the pad. Troubleshooting. Check the power supply. Make sure there is a good connection to the unit. Try a different outlet. If you notice that your pad is no longer cold or there appears to be no circulation, you can try following the troubleshooting options. Check the length of the hose. Make sure there are no kinks. Check the water levels to make sure the water is at the fill line. Empty the pad. Step 1. Unplug the power supply. Your unit should not be connected and you should not hear the motor running. Step 2. Disconnect the pad from the unit by pressing in the silver tabs and gently pull the connections apart. Step 3. Over the sink, hold the pad so that the small hose is facing down. Press in the tips of the connections just past the O-rings. This will open the valves. Hold for 30 seconds. Step 4. Reattach the pad to the unit. Clean the filter. 1. Unplug the power supply. Your unit should not be connected and you should not hear the motor running. 2. Empty the cooler. 3. Under the motor casing, you will fill 2 small prongs or dowels. One of the prongs has a small cap. Pull the cap straight down to remove. Run the cap under warm water using your fingers to rub the cap to clean. Place the cap back under the motor casing on the prong. DJO LLC offers a warranty on the Iceman and will repair or replace all or part of the unit and its accessories for material or workmanship defects for a period of 6 months from the date of sale. For product support, call 1-888-405-3251 or 1-760-727-1280.